But you can actually say you are not so okay today. It's a mixture of okay and not okay. That is good. You can honestly share with other people your genuine emotion, right? And sometimes people also fear of what? Burdening others when they say I'm not okay. Do you feel burdened if I tell you I'm not okay now and I leave now? Pastor, you can continue my slides. Why? It's not okay. Do you feel burdened? Yes? No? Oh, too bad. So I hope we can actually equip you in future. We have more workshops that you will learn how to not feel burdened when people say they are not okay. Because all you need to do is just to listen to what they need. You don't need to do anything. Because when they are feeling lonely, when they feel very emotionally struggle, they just need one person who is willingly listening to them. Can you listen? How many years you have? Two. How many mouth you have? So you can only hear, don't talk so much. Yeah? Right? So when people say they are depressed, they're feeling not okay, listen. Right? Okay. So some people, they also have this professional consequence, like what I mentioned earlier, right? If they are stewardess, they are pastors, they are leaders, they cannot show you they are depressed because that will actually create a lot of troubles. So because of their professionals' conduct, they have to show you the smiling front. Yeah. So these people who smile, always smiles, you always want to also ask them, are you okay or not? Really okay? Yeah. On a scale 1 to 10, how will you rate yourself? How will you rate yourself? Johnny, 1 very bad, 10 very good. 8. Nah. This is a genuine answer. Nobody will be 10. If they tell you that they are having 10, there must be a problem. I need to ask Pastor also. Yeah. Yeah. So do you know about these people from Bibles? Yes? Okay, Pastor, you have. This is your turn. Yeah, I'm not very good in English Bible context. I told them earlier, so I feel very nervous to talk in front of you guys. I can show you my vulnerability, lah, right? But I must share with you these 3 very famous person from the Old Testament. Do you know Job? It's not your job, it's Job, right? He's probably the one who suffered the most in the world in this Bible that we know in the Old Testament. He's the one who is the richest in the world also, correct? But he suffered the most. What about Elijah? He worked a lot. He said he actually win the he had the victory over the prophets, but then he was actually being forced to run away because the queen wanted to kill him. Remember this story? Yes? Yeah? And King David, you know, right? He always being forced by the king Saul, correct? Yeah, so all the Psalms stories is about his sorrows and sufferings. Yeah, what did they say? When Job suffered a lot, he has a great loss because just a blink of eyes, he lost all his families, his wealth. He was living in the devastated conditions. He has a lot of physical illness as well. And he said what? I have no peace, no quietness. I have no rest, but only turmoil. Is that how you feel when you're depressed? It's like you are on a uh, on a ship in the storm, right? And then he said, I love my very life. Therefore, I will give free rein to my complaints and speak out in the bitterness of my soul. And terrors overwhelm me. Overwhelm is a very strong word, right? And then he said, now my life earth's away. Days of suffering grip me. Night pierces my bones. Do you have that moments when your bones is so painful? Anyone have changed your kneecap already? Yeah, that's exactly how he feels, right? Yeah, and he never able to rest during that period. And you know why his friends actually talked to him? He has three friends, correct? Initially, they are very kind. They come to him, they even tore their robes and silently sitting with him. Companionship. Is that what you want when you are in sorrows? You want somebody sitting next to you, even though they cannot share your pain. They actually accompany you. They listen to you silently, right? Very nice, very compassionate. But after that 7 days, what happened to them? They start to tell him, they become very harsh. They say God is just. God will perish people who have sinned against God. Do they know actually Job has sinned or against God? They don't know, right? But they assume. They accuse him some, right? So the lesson of the story is that when we actually suffer from a condition, it doesn't mean that we always have sin. It's actually from Bible, not from me. From Bible. So we know that when someone is actually going through suffering, it's not always punishment for sin. And that's why we shouldn't assume that someone is suffering is because have sinned against God, although we are all sinners. All right? And what God's response? God rebukes his friends. He said, I'm angry with you and your two friends because you have not spoken the truth about me. If we actually say God punished somebody and God did not have that meaning in that way, actually against the Ten Commandments already, you know, right? God said that you have not spoken the truth about me because as my servant Job was. Another person from Bible is Elijah. He's a prophet, right? He was discouraged. He feel worried and afraid. He said, I have enough, Lord. He said, take my life. He's suicidal, right? Elijah was suicidal. He's the greatest prophet that we know, right? He said, I'm not better than my ancestors. Take my life. I don't want to run again because I just can't afford. You know what God says? God says, let him rest. God says, you need to sleep enough. You need to eat. So he asked the angel. Angel asked him to wake up because he was so tired, exhausted after he ran away from, who is that, Jezebel, the queen Jezebel. So the God actually asked him to rest, asked him to wake up and eat because the journey is still long for you. Right? That also tell us today, before even you see a psychiatrist, have you tried to rest enough? Have you eat enough? Okay? So all come from Bibles, not from me. Right? This one you probably know also. King David, he was so troubled and battled in the deep despair when King Saul actually go against him, go after him. He complains a lot. If you look through the Psalms, he always complains. But at the end of the last verse of the Psalm that he will actually write, he will say, why are you downcast, O my soul? Why so disturbed within me? Put your hope in God. What did he say? Put your hope in God. For I will yet praise him, my Savior and my God. Will you do that when you have all these sufferings? Do you remember God? Or do you blame God for all the things that you're actually suffering? Learn from David. So what does he say? Actually, all humans will experience emotions sometimes or a lot of times. Okay? And emotions are normal. So we can have emotional turmoils, but not sin. We shouldn't sin against God. And he allows us to have emotions, difficulties sometimes. So what we can do is to manage our reactions to those emotions so that you can actually glorify God one day. right? So the true story about all these stories is that many others also experience that is, God was, and is, and will be with us, even though we're suffering a lot in our world, in our life in this world, right? This is what King David said. The Lord is close to the broken heart and saves those who are crushed in spirit. If you crush in spirit right now, remember that God is with you, right? God shows compassion. God shows mercy. God shows hope. He instilled life, hope, and victory in the end. He understands our pains because He sent Jesus, who actually understands all of our pains. And He is not stopping there. He actually reaches out to us with compassion and hope. Okay? So, although we know that God is there forever with us, but it doesn't mean that when you have depression, you don't need to seek help, right? So these are the general principles that how we actually help people or approach people who suffer with major depressive disorders. So that actually depends on the level of depression. So if you have mild, 5 out of 9 symptoms, then usually we will look at, because it's mild depression, so we will help you through the talking therapies. We also make sure that you have eat enough, sleep enough. There was one patient of mine who recently went to Australia. I think it's a winter there now, right? Yeah. She said, I feel very cold recently and I feel depressed. Do I need to retake my medications? I said, have you exposed to sunlight enough? The next day, she went out to New Zealand. She said, oh, I'm happily enjoying New Zealand with my daughter right now. I said, yes, you need light exposure. Yeah, so don't keep yourself in the room all the time. When you're depressed, you need sunlight. You need the light of God. Okay? So modify your lifestyle, right? We also do therapy, trying to help you to go through the difficult moments in your mind, because sometimes when we are depressed, we cannot think straight. So professionals can help you to reframe your thoughts in a more positive way so that you don't always go into that deep despair moments, right? We also have medications for people who are suffering from a moderate to severe depressions. We tend to give them medications. And of course, there are different types of medications. I can tell you there are thousands types of medications. So if one type of medication doesn't suit you, I can offer you the second, the third, the fourth. So never lose hope. You have menus. Just like you go to Kopitiam. Yeah. We also have adjunctive medications as well. So when we fail the first line medication, we also have second line, third line medications that is available. What I want to share with you is never lose hope because there are many options there, right? So welcome to talk to the professionals, all right? There are other new treatments available when the technology advances, where we actually can stimulate your brain, and some of it is not invasive, so it's very helpful. Old time you have ECT, right? You know, is it anyone experienced ECT before? If you even you experience, you won't admit. Shout your brain, and then you forget everything. Yeah, you know that therapy, right? So nowadays we shout your brain, and you won't forget everything. You will remember me even better. That is called RTMS. Yeah. So that is technology, is advancing. Again, I want to bring you another things that I want to highlight. Never lose hope, because you will never know when the help will arrive. Yeah. We also have digital health intervention. When you're younger, at your age of 20s, you never snapshot, right? No PPT. Now people can use apps, can use AI some more. You don't need to talk to me, also you can talk to AI. You have ChatGPT? Do you talk to your ChatGPT? and say, I'm depressed right now. Can you talk to me? I'm lonely right now. Can you talk to me? Do you do that? Okay, no admit. You can do that. If you can't see me early, at least you can talk to the ChatGPT. All right. So that is what we call digital health interventions. Again, there is always hope. There are many menus available. Right? Um, I just want to quickly go through this because many a times when people started to take medications, they worry that they will take the medication for lifelong, right? But it's actually not true. According to the latest guideline, if you're actually free from the symptoms for at least half a year, if this is the first episode, you actually can stop medications 6 months after you recover from your condition. But not too early because the risk of relapse is high. So what we usually say is 6 to 9 months. If this is a second or third or fourth episode, it's multiple episodes that you experience, then we actually encourage you to take up to 24 months, means 2 years. Again, it's not lifelong. Yeah, so there is no dependent on antidepressant. Don't worry about that. Okay? Yeah. So now come to the last part. As a church member, how can we help each other if someone is suffering from depression? What can you do? Ask more, how are you? And don't just stop there. Can you do that? And then start listening, right? We allow them to be vulnerable. When they come to us, they say, I'm depressed. Then you don't say, you must have sinned against God, right? What you can say, God be with you. So do I. Can I? Can you? Can you? Yes? If you cannot, then ask them to at least download ChatGPT. Huh? You can share with them their struggles, their testimonies, right? You can provide them with resources. Some of the churches started to have counseling service, which is good. They also had this support group. Yeah, I do know some of the Methodist churches, they do this, especially for those who are oppressed, for example, single mother, for example, those who have special needs, right? These are the people who have higher risk. When you actually come together and help them in this support group, you're actually helping them to go through the fellowship and treat the diverse group as part of the community, right? And then we also can bring them together through prayers and scriptures. And that's why pastor will tell you, must read Bible. You must know who is Elijah, who is David. Actually, the most classic person who are feeling sorrows and depressed in the New Testament is, you know who is that? Apart from Jesus. Jesus, we cannot say he's God, ma. That's right. That's why he can actually endure and feel more resilient than anybody else. He is God. But there are many people, his disciples, like Peter, like Paul, right? They are very significant testimonies to the church, right? So you can share their scriptures and come together as a fellowship. Yeah. There's only one step I would like you to do this after today's talk is that when you ask, how are you, don't stop there. If you notice somebody who is really having some emotional distress, you can tell them, do you mind if I check in with you again next week? You will bring hope to them. Can you do that? Yes. Are you asleep? No, 10? Can you do that? Do you feel? Yeah, good. Good students. Yeah. Yeah, this is my conclusion. Smiling depression is a hidden battle. And a lot of times we cannot detect them in very good manner unless you always practice your skills, right? Even the strongest person can hit the emotional rock bottom, but we can actually help them, just like how our God teaches us to treat them with the compassion, not condemnation. And you, as a church, can make a difference. Okay? To make this place, the church, as a place of truth and grace, and help them to go through the spiritual care and emotional support And if needed, you can refer them to a professional resources. All right? With that, I thank you all of you.
No? So it's an exciting time that we want to embark him back with all the questions. So we are going to have a Slido. Those who have questions, you can scan the QR code, and we have paper and pen. Our usher will distribute those who want to ask the questions. Then you can write on the paper, and then he will pass to me. Okay, so you all can scan and then type your question from your phone. You can raise your hand to get the paper and pencils from Brother Albert. Not sure they can. Or you just want to raise your hand and I will go to you. So ask directly. Anyone?
Those who can scan, I'm sure that you can use ChatGPT.
We had to show to him that we can use Slido. He said our church cannot use Slido.
Sorry, this is condemnation.
Yes, we can use Slido. So we'll wait for the questions and Dr. Ting will answer. Yes, can ask direct.
People who have thyroid disorder are more susceptible to depressive disorder. Is that your question? Yeah. Yeah. Apart from thyroid, there are many other chronic diseases like diabetes and all. Because when you have uncontrolled medical conditions, it tends to cause an inflammatory response in our body. And this inflammatory response actually doesn't hit just one place. It doesn't hit your kidney or your liver only. It will hit your brain as well. It will hit the hippocampus, the area for memory. It will hit the frontal lobe. It will hit the emotional centers. It will hit many places in your body. And that's why when you have uncontrolled medical conditions, it can easily cause other comorbidities like depressive disorder. Yeah. This is something we can't see, right? Yeah. Another thing is if you are stressed because you feel like, oh, I don't want to get insulin, but the doctor say, Johnny said, no, you have to take insulin already. It's too late. You ask you to take oral medication, you never take. Now your HbA1c is 10%. Then what to do? Need injection. So very stressed. So the HbA axis also disturbed. And that stress, the cortisol level increase, also will cause problems to your brain. Yeah. Correct. I need to ask my seniors.
So we have quite a lot of questions there on the slide. Can we start from the first question? We go up to the first question, then you can answer from top down. I think there are questions above.
The first one is this.
I
Do
think
psychiatrists
I think above got some.
ever get depressed? As they listen to many patients and depressive encounters. What do you think? As I assure you, I'm not depressed now. It doesn't mean that I don't get depressed later. Yeah. I am human also. So all the psychiatrists are also susceptible to depression. But that's why we need to learn how we can actually relieve our emotional distress in a more healthy way. Yeah. But I don't see your depressive encounters and all that you share with me during my clinic sessions a problems of mine because it's never my problem. Yeah. So I can take it, I listen, and I help you to go through, I journey with you through that. I feel more satisfied than depressed. I believe more of the psychiatrists will do that. And that's why they want to become a psychiatrist. Most, not everything, not everyone. Yeah. So the answer is yes, but we learn how we can actually cope in a more healthy way. The second question, doctor, what's your advice to those who already hit by anxiety and depression? Continue to see me. Continue that medicine. Continue to lead your healthy lifestyle. Continue to share with others how difficult you go through it. Continue to read Bibles. Continue to combine all these potential help and resources that you have to help you to go through that rock bottom. Yeah, never give up. Smiling depression has the same suicidal rates as other depressive persons. I have difficulty to answer you this question because that it is not a formal diagnosis in the SM5, like I said. So that's why there is a difficulty for us to do research on that. But I must share with you, many of them later on in their life, they become a major depressive episode because the hidden depression was not addressed. And that becomes very significantly impact their life. And that later on raise the suicide rates. That's for sure. Yeah. In your practice, do geriatrics face more depressive symptoms than working adults? Why? This one I must ask Johnny. Because she sees more geriatric population than me. But I must say, most of the geriatrics populations that come to me, they usually have more other things like chronic medical conditions, like dementia, right? And that also put them as a higher risk of suffering from depression compared to young adults. But working adults, I, I don't know how many working adults here. Are you depressed? Are you more depressed than your mom and dad? You say you can tell everybody. Yeah, yeah. I'm sure if you have a very stable job, you probably don't feel that depressed compared to those who have a lot of jobs instability, right? So that really depends on the psychosocial factors that is affecting you. Right. Next, have reliable in cognitive behavior therapy or on ChatGPT compared to seeing a psychiatrist. How? Oh, sorry. Yeah, I'm not ChatGPT. I cannot autocorrect. Okay, how reliable? They are more reliable where they actually can accompany you 24 hours 7, right? They can know what is your response all the time because they have stored how you actually ask them the questions, right? The ChatGPT, they are more advanced in that sense. They can collect all the data. People, sometimes we need to refer to the notes. But I must share with you, most of my patients, they want to come to talk to me rather than ChatGPT because you feel the sense of warmth. If you see the ChatGPT is very cold, they will sure answer what you want, but they will never get into your heart, right? So do you want the warmth or you want the mechanical answer? Your choice. Can someone who encountered depression before be a mental health therapist to help others? Yeah, why not? That's why I asked you to share your life experience with others. Because if you have that experience, you can probably show more empathy to the people who suffer in the same condition. In fact, many of my patients, young adults, they decided to take second degree after that. And they choose psychology course. Yeah, I encourage them to do that. Yeah. Is there assessment test to detect have early signs of depression? You can use PHQ-9. It's very commonly available online. PHQ-9. Okay, PHQ-9. If somebody who tell you, I don't think I have depression, and you feel this person has depression, you ask the person to read the scale first. Yeah, PHQ-9. PHQ-9. Okay. Yeah. So when they are able to, they won't tell lie to themselves, I suppose, right? When they do the scales, and then when they actually do the scales online, and it will be well reflected in their life. So usually when people they deny they have this problem, I will ask them to do that and then show me the answer. Yeah. How can I encourage someone who is I just told you. You try use PHQ-9. The other thing is, you can actually tell them, it's not easy to come to psychiatric clinic, you know. It's very difficult to walk in even into my clinic. My clinic in Sentosa Hospital, once you drive in, then you will know. How do you feel? If you go there, it's the hospital killer. Correct? Yeah. And you worry your neighbor will saw your car, will see your car entering the hospital. Correct or not? But if your neighbors see your car going into the hospital, that means they are also seeing the person. So you don't worry about that. Then you become each other's support. Can or not? Yeah, so don't worry about that. If somebody seeing you in the hospital, they must have their own problem also. So they cannot laugh at you. Yeah, so don't feel reluctant to see us. Huh? Yeah, it's easier. You can open out to the person later. Right? How to help a student in higher learning facing depression of SM? Wow, this is very difficult question. If you are professional mental health workers, then maybe easier for you to handle. But if you are not trained, I will actually again advise you to go with them. You don't leave them suffering alone. You say, I go with you to see a doctor, to see a counselor, to see a clinical psychologist. Going with them is very helpful because they don't want to enter the clinic by themselves. It's so difficult because everybody will see me. But if I go with you, you are not having problem, right? You accompany other people, okay or not? Can you walk to the hospital and tell other people, actually, I accompany someone? Can, huh? You can do that, huh? Yeah, so you accompany them to go to the clinic and see doctor. That will be very helpful. Until they get familiar with the doctors, they know how they can actually get help. Then by then you don't need to accompany them already. Just the first few times. Will you want to spend the time for them? Okay. Yeah. How to treat anxiety disorder? Any self-help? There are many resources available online, like ChatGPT. If you look at the Australian resources, that they are very good in mental health literacy. So once you type in Google, you actually can find quite a lot. I personally like to use this one from clinic. What is that called? Too long I never use. CCI. It type CCI, Center for Clinical Intervention, I think, right? Online, you can actually find quite a lot of self-help booklets, workbook, worksheet on that. Yeah, and that will be very useful, especially for people who are more reluctant to go to hospital at their initial phase. So at least they have something that can help themselves first. And once they are more comfortable with that, they can actually go to doctor when they want, right? Apart from that, you need to take medications. That depends on the level of anxiety. What can we do if we are depressed? Any exercise to do to distract from it? Oh, that really depends on what exercise you like to do. Yeah, I have some patients who really don't want to do exercise because they just don't like exercise, right? So you can ask them to walk from 5 minutes to 10 minutes to 20 minutes. You can't ask them to straight away walk 30 minutes. It's difficult. Again, companionship is very important. If you can walk with them, that is even better, right? Or you can go to gym. Now there are many cycling program and all other programs available in the gym, right? I used to be more plump than now. Then one fine day, my friend asked me, oh, you never do exercise, is it? I said, no, I don't like sweating. If I sweat, I must clean myself right immediately after exercise. Then he said, you should go to gym because there is shower room there. Don't worry about that. Yeah, so now I can do exercise a lot more frequent. And I actually attend the classes. So most of the people in the class, they become your friends. They can share your burden. every Tuesday after my clinic in Sentosa, I will go for exercise. Yeah, that's how I actually cope with taking too much of negativity. Right? I go there, I do body combat, I punch all this out. I don't punch the patient, don't worry. Yeah. Thanks for the seminars tonight. Talk sound more for adults. Wow, another word for me. Can we arrange? Yeah. Is panic attack a type of depression? How? Oh, sorry. Where is it? Is panic attack? Oh, sorry. Do you advise Christians to seek help in psychiatrist that is Christian or religious? Religion does not matter. If you think this person is in the urgent need to get help, I rather you don't choose any professions from any religious background, because I suppose in our professional ethics conduct, we should never involve religions in our usual practice. But if my patient who is a Christian or who wants to listen to my stories, usually I would want to share my own true stories. It doesn't affect the professional conduct. So if you don't think that is urgently needed, then by all means choose what you want, because I want to let you know the help is always on the menu. You don't need to restrict yourself. Yeah. If you go to a kopitiam with just one menu, you probably won't go there anymore. Correct? You have more menus, then easier for you to go there because you want options, right? Yeah, but you cannot choose 4 wives. You can only choose one wife, huh? Yeah. Is panic attack a type of depression? How to help when the attacks happens? This is another topic. I think we need to arrange another time to talk. Okay, panic attack, if it doesn't affect your function, is actually a type of anxiety disorder. It's probably a little bit different from depressions, although the treatment can be the same. Depression is one type of mood disorder, and anxiety, the panic attack is on another entity. Yeah. How to help? It really depends on when the attack happens and what is the condition. So let's say, for example, if they experience the panic attacks with a very significant chest pain, I usually still want to make sure that we rule out any emergencies like heart attack, right? Or breathlessness. If they have any pneumothorax, for example, they might need to go to emergencies to do chest x-rays and all, so that we can save the urgent. We need to do the measures to make sure that they are in the not in the emergency situation. Then only we will say this is panic attack, because it can mimic all those emergency medical conditions. Yeah. So if in doubt, just go to emergency. How to help a person who is recovering from depression but ought to be withdrawn from meeting people? You go to these people. Like I said, you can check in regularly. If they cannot come out yet, you go to them first, one to one. When they are comfortable with that, then you bring them out. What's the difference between psychotherapists and psychiatrists? Psychiatrists can be psychotherapists. We can do therapy also. But as psychiatrists, we can prescribe medications. Typical psychotherapists, like clinical psychologists, they cannot prescribe medication. But they can do more things like more detailed assessment and diagnostic and also treatment, right? So there are special tools for them to do a lot of more detailed assessment, but they cannot prescribe medication. At what level of depression do we need to seek a consultation? Any level. As long as you are having depressive disorder already, means you have 5 out of 9 symptoms, you should actually get help already. Yeah, it's good that you don't suffer alone. At least you talk to somebody who can tell you what to do, right? So if you want to see early, it's not a problem. right? Can regular exercise and what kind of food helps to ease depression? Well, eat what you like to eat. Uh, Actually, it's part of the guidelines where you have regular exercise. The slide that I mentioned, lifestyle modifications about light therapy, light exposure, about exercise. We usually encourage you to do at least 3 to 4 days of 30 to 40 minutes moderate intensity exercise every week, 3 to 4 days in a week. Are you able to do that? Can, you have more time right now, huh? Yeah. So that is important. If you can do every day, it's better, right? And most of the food, as long as it's balanced diet and it doesn't, if you don't take junk food, you can actually have good enough nutrition to support your mental health. Yeah. But if you are not diabetic patients, banana is good. Banana is good to build your mental health. That's why all the people who went to gym, they took banana every morning. Are people who overlaugh, laugh very loud or frequently, sometimes, for things that are not so funny, a symptom of potential depression? I better ask that person. So, if this happens, what can you do? You can ask the person, are you okay? Can you? Are you okay? Yeah. I think it's just the threshold problem. Not a problem. The person have a lower threshold to feel joyful. It's good. Yeah. But it doesn't mean that the person doesn't suffer from depression. So again, one thing that you can do always is to ask, are you okay? Yeah. It's actually a program in Australia also. A person who actually lost his father to suicide created this program called Are You Okay? Uh, if you are interested in this program, you actually can look at it. Yeah. Should depressing youngsters be put on medication by their parents to quiet them down? Is this depression or anxiety or ADHD? I wonder. Uh, most of you mean to help them to feel better, right? Yeah. Uh, in most of the times, if we want to give medication, it must be to moderate to severe depression. If mild, then we can still wait. And most of the time, we will advise them to have a lifestyle modification, right? So it doesn't mean if they are young or they are old, we will decide on the medications. It doesn't mean that if you are young, you cannot take medication, or you are old, you cannot take medications. It always based on the holistic assessment. So if they are depressed enough to take medications, then we will always offer medications. Yeah. My mom is under medication for depression, but she is relapsing and cry every day. It's not easy to ask Sentosa Hospital to change or increase. Oh dear. Uh, Let me know if I can help. Maybe I can help you to adjust medication. Uh, or you ask the MO to come and see me. But I'm only there for Tuesdays. Actually, not too difficult to ask them to change medication. You just need to ask. Because every time you see different doctor, right? So you will hit one doctor who is willing to change the medication. um, I hope so lah. I can't guarantee for others. But if you are looking, if you are seeing me, that I will try my best to listen to you and see how best I can help you.
Sorry, Dr. Bernard, I need to interrupt. In
Too
the
many
interest
questions.
of time, in the interest of time, so we let Dr. Bernard finish this question. So no more new question. Subsequent any more question, you go and find him during our refreshment, right? So just answer.
OT.
So just let him answer during that. So we finish this one first, then we will go off.
Thank you.
Thank you.
A patient with depression used to do various activities out of certain loss of interest in activities. Do we consider that patients as lazy? Yeah, you shouldn't call them lazy. They just have no energy. As I said, depression is not about mood only. there are a lot of things in our brain, especially the neurotransmitter, that help you to have the energy and also the initiative to do activities. When the neurotransmitter is disturbed, they are not able to do that, not because they are lazy, it's just because they can't start the engine. All right? So you need to give them the fuels. All right? Following to my question above about becoming mental health therapist, can you please advise? Oh, okay, you can email me. This one really very long path. Okay, let me know if I can help you with that. And welcome to join me. In your experience, have you seen those with schizophrenia overcome and heal? In our understanding, schizophrenia will never recover from the conditions, but they can be treated. So with medications, usually I will encourage not to stop medication, but continue with the minimal effective dose. So these need more intense discussion because there are many other things that we need to look for. For example, if they have any early signs of relapse when we cut down the medicine. Because in our understanding, schizophrenia is very difficult to be treated because there is a defect in the brain that this dopamine is in excess. So we cannot stop that medication totally. Yeah. But we can give minimal effective dose, right? Is it normal for someone who's diagnosed with critical illness? CA means carcinoma, right? Is it? CA is cancer, huh? To deny it. He still smiles and say nothing to his friends about it. That is quite possible. If you understand about the process of grief, most of the time the first reaction they will have is denial before they come to finally accept it. So denial, and then they will have anger. Why? They will ask God, why me? Why? I do so much thing for you at church, and you choose me to suffer from cancer, right? And then they start bargaining. Can you give me 1 more year, 2 more years? I want to do more mission for you, right? Then the next thing they will say, I feel very depressed. I can't fight with it anymore. Okay lah, okay lah. Finally, I accept it. So this is a process of grief. They started to experience the loss even before they lost their life. So these are the journey can be very short, can be very long. So when they actually deny, it can be a normal response. So we need just to go through with them and work with them until they can accept that. I still remember my mom when she suffered from cancer, breast cancer, and then she's still alive. She cried and called me. I was a houseman in orthopedic, my final posting. She called me. The doctor say I have something. I was like, oh, okay. How can I do? I also blank because I have seen quite a lot of patients, but I never see my mom herself to be suffering from the severe medical condition. Those days you would think cancer is very severe, right? And she was crying. So I went to my HOD. I said, can you allow me to go back to comfort my mom? I asked, and then they granted. So I went back. I helped her to go through that phase. In 2-3 weeks, lucky enough, I'm a house officer in Cebu Hospital. In 3 weeks, she managed to go through all the assessment and she go for surgery without second thoughts. Yeah, so it's important for us to actually accompany them and go through the difficult period because it's difficult for them to accept that, especially when ladies when they suffer from breast cancer, it's actually loss of their identity. They need to take off the dignity as a woman, right? So when we actually help her to go through the difficult period, and then she recovered quite well. Yeah. She went through all the chemos without any problem until the last cycle. I think maybe it's God's wills because I was surgical MO at the time. So I managed to admit her to my ward directly after she had the side effects from the last cycle of chemo. Then after that, she was okay. And then she still complained me, putting the needles very painful. Even the nurse is better than me. Yeah, I remember that. Yeah. She hurts me. That's okay. It's a joke lah. I told her, that time when you are so seriously ill, you can still hurt me. But at least she recovered. I thank God for that. And she actually experienced the God's grace through this process. And she said she experienced the last, I think she was delirious. But she said, I saw Jesus come to my bed because she is a government servant's family. So she is entitled to the VIP room. She stayed there inside alone. So she saw these people in white shirts and come to her and comfort her and things like that. I take it as she really experienced God. Last time when she actually asked me, when I said I want to get married, but I don't want to put job state and all that, she said, I feel regret to ask you to go to the church. By then, she never regret about that. Yeah, she experienced God herself. So I thank God for that.
Okay, we thank Dr. Bernard as on the usual way. So thank you for sharing and giving the struggle behind the smiling face. Hope